Hi everyone, this is Angie Hotchkiss. In the second video for week 1, we're going to be discussing how to read a rhythm strip and then go into our first set of rhythms called sinus rhythms. If you remember from the first presentation, I mentioned different leads. On this slide, you can see on the right there is a 12-lead ECG. This is what cardiologists and practitioners use to determine a patient's cardiac heart health, electrical heart health. The different waveforms at the bottom are the different types of the 12 different styles of waveforms based on where those electrodes are picking up the electrical activity from the heart. So there should be 12. I'm not going to go and explain them, but just realize that when we go through the different strips that we will be measuring, that they will look a little bit different, but the waveforms are still the same. You still have a P wave, a QRS, and a T wave. Other tools that we use to measure besides the 12 lead are 5 lead, and 5 leads are used on telemetry units and ICUs, and then the 3 lead is a lead type that we use during procedures. I wanted to share a couple of rhythm strips with you, identifying interference. So on the top one we have electrical interference, where the isoelectric line is a little wider with small squiggly lines. This is most often seen when patients are using their electrical razors. Next we have patient movement, where the heart rhythm doesn't really match with what they're showing on the rhythm strip, and this is because they're moving around and those leads are moving around on the body. Here on the no lead placement, we have a flat line. Well, a flat line does mean that there's no cardiac conduction going on, but most often it's because the lead set is not connected to the telemetry box. The patient went to take a shower, they didn't hook up their lead box is not hooked up on them. So if you see this, you may want to go check on your patient, make sure their lead set and their box are connected together and the batteries are still good. Muscle tremors often look like the patient movement up here. Just be aware that that is not an accurate rhythm. So now we're getting into how to read cardiac rhythms. Now I'm using the 6-step method that is outlined in Gail Walvren's Basic Arrhythmia textbook. You can review it there for more tips, but I'm going to just go over quickly what these 6 steps are. First is regularity. When we look at an R to R interval from R wave to R wave, is it constant, is it irregular? Next we're going to look at the rate. What is the rate of the heart? And I will show you 3 different ways on how to calculate the rate. P waves, are they regular? Is there a P wave in front of every QRS? Is the P wave upright, which we'll see in lead 2? Is the shape consistent? Are there more P waves than QRS, which we'll see in blocks later in the program, in the modules? And then PR interval. Are the PR intervals constant? Is the measurement in the normal range? If there's a pattern, if not in the normal range, and again that has to do with blocks. QRS complex. Are all the complex consistent? Some aren't, and we will talk about those. They're called contractions. And what is the measurement? What do they look alike? And then based on all that above, we'll figure out what the rhythm is. So the first step in determining interpreting rhythms is regularity. And as you can see, I marked out the R to R intervals here. So we have the R to R intervals. And what we're looking for is we're measuring from here to here, and then we're going to make sure that this number that we get here is the same with this number right here using our calipers. So we're going to open up our calipers, place 1 point here, 1 point here, and then we're going to lift up and drop it down exactly over the next two to making sure not to close the calipers. And we want to make sure that they are almost the same. They're not going to be totally exactly the same. There might be like a half a square off, but they'll be pretty much consistent. So that is what we're looking for with regularity. You can also look at it from P wave right here to P wave right here. They should be consistent. And then we can take our calipers and measure from P wave to P wave and then bring it over and make sure that this P wave to P wave is the same. Now when we determine the rate, as I mentioned earlier, there's 3 different ways that we can determine it. There's a 6-second method, there's a large square method, and the small square method. The most accurate is the small square method, and we will go through each of those. And as you can see, this is a calipers. They're very handy. If you are going to be spending any time in the cardiac area, if that is your passion when you're done with nursing school, I would encourage you to purchase a pair. You will need them for school. If you're going to be doing any clinicals in the cardiac area, there's usually calipers hanging around somewhere on the unit. Okay, in the first rate calculation, we're going to use the 6-second count method. This is the easiest one to determine. It's a good way to get a quick reference. Now, if you remember from our first presentation, I talked about how each of these small squares, if you have 15 here, is equal to 3 seconds. Okay, 3 seconds. And then 30 of them, which we have here, is equal to 6 seconds. Now what we're going to do is count the number of R waves. So we have 1, 2, 3, 4, 5, 6, 7. So 7 R waves. And then we have 6 seconds, and if we multiply 6 times 10, we have a minute. So all we have to do is multiply this 7 by 10, and we have 70 beats per minute. Very easy, huh? Now for the large square method, we're going to be counting each of these bigger squares right here. Remember from our last slide that this is 3 seconds, 3 seconds for a total of 6 seconds. Okay. So we're going to count the number of large squares between 2 consecutive R to R waves. So I try to always line up get an R wave that's right on one of the lines of the big box. And then you're going to count the number of big boxes in there. So we have 1, 2, 3, we have 4. Now this is not exact because we're not counting the little squares, but it gives us an idea of where the heart rate range is. So we have 1, 2, 3, 4 large squares. 4. So we're going to divide 300 by 4. So you'll need your calculator. So 300 divided by 4 is equal to 75. So your answer will be 75 beats per minute. And you can only use this now with regular rhythms. Okay, that's a key to a quiz question. The last rate calculation method that we're going to look at is called the small square method. It is the most accurate and it does take time. And if you're good at math, then you'll have no problem with this. Again, we have our marks. So we know that this is a 6-second strip from here to here. 6 seconds. Okay, so now we're going to count the small squares. And for my visualization, I am going to get this a little bit closer so that we can see the little boxes in between. So we're going to count each of the little boxes, and I'm going to go use this one right here. This one right here, right there, and we're going to count to this one right here. So we have 4 squares here, four small squares. We have 5 here, 5 here, 5 here, and 3 here. So we have 15, 18 plus 4 is 22. Is that right? 5, 10, 15. Yeah, 22 squares. So we have 22 squares, and we're going to divide that into 1,500 to get our rate. And we have 68 beats per minute. So that is the heart rate using the small square method on this particular rhythm strip. And I would encourage each of you to practice using these different rate calculations in your basic arrhythmias textbook. Okay, when we look at P waves, when we're determining what kind of a rhythm we're looking at, we want to make sure that we have a P wave in front of each QRS. We have a P wave, P wave, P wave. They need to be, there should be one in front of each QRS. They should be consistent, and they should be uniform in shape. Now that is a key for the quiz. You want to make sure that you're addressing what those P waves look like when you do your interpretations. And the PR interval. The PR interval, if you remember, needs to be between 0.12 and 0.2 seconds. And this is a typo, so 0.20 seconds. And we are going to take our calipers and measure how many little squares are in between from the right here at the Q wave to right before the QRS right here, and the P wave, the beginning of the P wave. And we have 1, 2, 3 blocks. So this PR interval is equal to 0.12 seconds. You want to make sure that that PR interval is the same and consistent through the whole rhythm strip. If it's not consistent, is there a pattern? Well, there sometimes is a pattern when it's not consistent, and we will be looking at that when we look at heart blocks. Now with the QRS complex, we need to make sure that there is a QRS complex after each P wave. So we have a QRS there, and a QRS there. And if we blow this up a little bit, we'll be able to measure how wide our QRS complex. So I am going to measure from, use my pen here, a little hard to see, but it's going to be right here to right here. And that would equal 2 small boxes, which is equal to 0.08 seconds. And this is how you will write on the exam, 0.08 seconds. Wow, we're already on the interpretation slide. We have gone through 5 steps and we are ready to interpret this rhythm. So based on what we found in the other slides, we found that this rhythm is regular, so we're going to write regular. The rate using the small square method was 68. Remember to put your measurement beats per minute. The P wave is upright, consistent in form, so you can just put consistent before each QRS complex. And this is a hint. This is how I want it written. You will answer on your quiz. Each QRS. And the PR interval we measured at 0.12 seconds. And the QRS complex was 0.08 seconds. Now we know that each of these are right within the normal parameters of sinus rhythm. So we have determined that this is a normal sinus rhythm, and for normal, sinus rhythm with a heart rate is equal to 68 beats per minute.